Good morning, everyone. Thank you for joining me. Allow me to introduce myself. My name is Georgie Gould, and I'm the Project Assistant at Global Community Resourcing. I'm pleased to be the co-monitor for today's webinar and joined by Global Community Resourcing's Director of Projects and Research, Anne Livingston. Welcome, Anne.
Thank you, Georgie. The focus of today's webinar is extremely relevant with the times at the moment. We're going to do a session this morning on coronavirus and forced innovation. Our webinar today is facilitated by Global Community Resourcing for the Community Care Smart Assistive Technology Collaborative. This collaborative has extensive international linkages, and we've been fortunate to work with many international projects and research entities.
If you've joined us for previous webinars, you'll know that they are designed from feedback and requests we received through the collaborative. The focus of our webinars is to bring together local, national and international perspectives in research and development, as well as deployment of smart assistive technology in the community care sector. Just a reminder, if you haven't formally registered at the collaborative site, it is accessible to all and free to register. Please visit www.satcommunity.com.au to register now. Please note that Global Community Resourcing is not promoting or endorsing any particular product, research entity or organisation. The purpose of our webinars is to serve and to inform viewers of various smart assistive technologies currently in deployment and/or development. We welcome questions, but I'll let you know that today's presentation has been pre-recorded. If you have any further questions, please contact the collaborative research team via sat@communityresourcing.com.au.
Thanks, Georgie. In this webinar, Dr. Sabrina Pitt will present an overview of her personal experiences with the current health pandemic with respect to COVID-19. And she'll reflect on how innovation can play a part in workplaces during this time. It's my pleasure to introduce Dr. Sabrina Pitt. Dr. Pitt has been working in the education, workforce, ageing, research and health sector for more than 20 years. She is the Director of WorkWiser International and a certified sustainable employability coach. Until recently, she was the workforce research stream leader and lead academic, clinical and educational research at the University Centre for Rural Health as part of the University of Sydney and the Western Sydney University. She's also a non-executive director of a rural disability provider and holds various member positions as part of the International Organisation for Standardisation, ISO, Ageing Society's Technical Committee through Standards Australia, including convener of the Age Inclusive Workforces Group. She has been a lead contributor to the international standards, particularly those related to human resource management, sustainable employability management for organisations. We welcome you to the Community Care Smart Assistive Technology Collaborative. Dr. Sabrina Pitt, welcome.
Thank you, Anne, for having me present today on the coronavirus and forced innovation. So the topic came up because I thought about a crisis. It always takes a crisis to find new ways of working. And I wanted to talk to you about how the coronavirus can also help us in a positive way. So I know there's a lot of angst in the community, but we may also learn some things along the way that we can use into the future as well. So it'd be great if people can have a different thinking around it sometimes, especially when we talk about the way we do our work. So for me, my personal story started in January when the coronavirus outbreak started in China. I got calls from family members being worried about my daughter, my 15-year-old daughter, being in South Korea. At the time, I decided with my husband that it was okay to leave her there. And so if you can see on this slide here that on the 9th of February, Korea only had 27 cases. So we didn't see any cause of concern, and we also consulted with people in the health department. So fast forward by the day I started traveling to Korea to pick my daughter up, a lot changed on that day. And you can also see that on the 8th of March, we had 7,000 cases in Korea, which is now today, 4 days later, almost 8,000 cases. Now, Italy has gone from 5,000 cases or 6,000 cases on Monday to about 15,000 today. So things are changing very rapidly. So on the 9th of February, I wasn't worried, but I thought, well, okay, just to be on the safe side, I'll just start looking for masks and goggles. So I looked around in rural Australia where I live and couldn't find any. Bunnings was sold out, pharmacies sold out. So I thought it was a little bit odd, but mind you, we've had the bushfire, so I thought it might be because of that. Some people, that was their explanation. So I finally found a couple of days later, a few days later, one in Sydney Airport. And I think the masks were about $8 each. So the prices have gone up a lot, I think. So it started, I started wondering about the shortages of masks for our health professionals. But again, it was, only around 11, 12 February from memory. And I thought, well, we'll see what happens. So I arrived in South Korea on the 18th of February. Now, the night I arrived, I had the first case in Daegu, which I call the epicenter of the corona in South Korea, because this is where it spread rapidly through a very large church that had large gatherings. So there was a very stark contrast between the flights between Australia to Seoul and my flight between Seoul to Daegu. So about 50% of people were wearing a mask from the plane from Australia, but 100% of people were wearing a mask by that point. And I didn't know what was happening in Daegu because I was just flying. So because everybody was wearing a mask, I thought, me being a sheep, I thought, well, I'll just follow the herd, I'll wear a mask as well. And so I put one on, and it felt a bit strange initially, but you get used to it after a while. So the night I arrived, I walked through the CBD, and the Koreans that were so kindly to take me out for a coffee around 10 o'clock at night, they looked kind of shocked, and they said, oh, it's so empty, and where is everybody? And I thought, it looks pretty busy to me that night. But my daughter then explained to me that usually you can't walk there. It's so busy that it's so incredibly crowded. And so now there were not that many people. So this was the next day, during the day, when I decided to start taking photos of the corona virus, what was happening in Daegu City. So I started to learn that the tours were cancelled. Initially, I thought, why are they cancelling the tours? Because news from me wasn't filtering through as quickly as obviously when you speak the language. The restaurants were empty. And so on the 20th of February, we decided to just go on our own and do some sightseeing because there was no tour going, everything. No one wanted to organize or lead tours. So I got to museums. Museums were closed. I saw warning signs in public transport. So we caught a bus, there were people on it, maybe 4 or 5, again, usually full. And I happened to sit here with a warning how you manage yourself in the outbreak. So we got to a museum. This was a machine that was in the museum. Again, the museum was closed, and this translates to prevent coronavirus, please wear a mask and use hand sanitizer. So this machine was a hand sanitizer one, and it was explained to me by the people that were still working there that all museums in Daegu were closed from that day onwards. So that was the end of my museum trip. Another example I want to give you is a shopping center. So again, I went to that shopping center on the day that I arrived, and then went again on the 20th. And as you can see, by that point, I had installed a hand sanitizer and a shoe sanitizer machine, or, you know, procedures. So, which was interesting. Again, an example of how they would use that in a below ground shopping center. So we would, you know, look at that, go through the shopping center, and again, an empty, pretty empty shopping center. Only the staff were there. We had to go to the department store to buy a suitcase because my daughter had bought a lot of extra Korean stuff she wanted to bring home. So I just, we went to this department store, and what you can see about the communication that had changed. So staff is wearing masks, obviously. By that point, everybody on the street is wearing masks all the time. You wouldn't see anybody without a mask. They said it's for staff and customer safety, and I think what we can think about is how it actually impacts our values. So they apologize for making you feel uncomfortable, the customer. So this is another photo of the department store. It's a very large business, again, usually packed. It was quite it wasn't scary, but eerie, really surreal. Sometimes I felt I was in a movie because there was no one anywhere really, no customers. And I think what we should think about the economic impact this will have on people. And again, staff were present, but there were no clients. So I guess they were very happy to see us. So it doesn't only affect the large business, but especially also, of course, a small business. Now, this is a cafe in Daegu Center, usually packed. They're sending staff home. And again, think about, you know, the loss of income people have. And for the casual employees, that will be an extra problem because when they don't work, obviously they don't have an income. So we need to think about how do we protect the casual workforce as well, because if they would be asked, for example, to self-isolate, they may not necessarily want to do this because they want to have an income. So we need to start thinking about creative ways about how we can avoid that and help people that are not in a permanent job. So office workers, the South Korean people I was talking to, they were advised to work from home. And you could clearly see that, again, the buses were empty. So this was taken from one of the busiest streets. The taxis were also reduced on the street, which I didn't realize. So, for example, I wanted to order a large taxi to go to the airport because we decided to leave earlier because we realized, you know, that it was getting out of hand really quickly. So there were some issues with ordering a taxi or a large taxi, and I didn't quite understand why. So I just thought, oh, you know, that will be okay. But then they explained to me that it was actually, you know, because they're trying to reduce the number of people on the street. So it wouldn't be that easy to get things done. So we were lucky after 24 hours of trying to organize to get out of Daegu. We got a flight out on the 22nd of February. And it was the last flight before Korean Air actually suspended the flights from Daegu. So I feel very, very lucky. We had to spend 11 hours at Seoul Airport. And whilst I was there, because I knew I was going to talk about technology, I thought I'm going to play with my new friend. He's called AirStar. So AirStar can dress nicely, and AirStar can also wink at me. So AirStar actually can do quite a few things. So as I was, you know, talking to my new buddy, he can also provide Corona advice, as you can see here. So I thought that was quite useful. I tried to ask him if I could get a Corona beer, but he couldn't tell me. So he could tell me where the closest coffee shop was, and he could take my photo. You know, he could tell me not to miss my flight and look at currency. So I think, you know, and people are generally really interested in AirStar. You know, it's a bit of fun, but there's also a seriousness to this that I think, could we use someone like AirStar to actually communicate things in times of crisis? So, for example, they can take your photo and send it to your home address, or to your email address, which is what we did. So is there something we can think about, you know, about education and health promotion? And if people want to know more or have more information about it, that it can be automatically sent to their home through the AirStar robot. So these are just some things to think about. So we got home and we had to go in self-isolation. I didn't have to. We talked about it, but we decided it was the safest thing to do because I think the government hadn't quite realized yet that South Korea was a hotspot for corona, and I just want to be on the safe side. So my daughter and myself have been in self-isolation for 2 weeks. So talking to people in South Korea, this is a photo that I want to show you from healthcare workers that are burning out. So this picture promotes supporting healthcare staff and volunteers in South Korea, just, you know, to help them get motivated so they don't lose motivation. So for myself, my work environment changed. My self-isolation obviously led to cancelling meetings. I had to send staff home. I'm doing increased remote meetings, obviously. My family also had to move out, so I just stayed home with my daughter who came back from Korea. I did feel a sense of increased isolation. I'm not saying, you know, that I got depressed or anything like that, but I did feel, and I was wondering what other people were doing. And I thought, wouldn't it be good if I could just, you know, go on a group somewhere and talk to someone about what's, you know, what are you doing in your isolation? Just a bit of fun, but also, you know, I was just interested how other people feel about this. I also do feel now I have come out of isolation that there is a little bit of stigma from other people. So I make a bit of a joke about it sometimes, but it does feel sometimes a bit like, well, what, you don't want to be with me because of what? So these are things that will increasingly become an issue for people and also for the workplace, obviously. So I want to come back to my quote. It takes a crisis to find new ways of working. So what the South Korean government, for example, does is they send out emergency health alerts. So every South Korean receives automatic updates on the coronavirus. So my daughter had a Korean phone, and this is an example of one of the messages that came through on Saturday. So they started off with sending messages maybe once a day. By the time we left, my daughter would get like 3 or 4 messages a day. So I think if Australia will do something like this for emergency health alerts, we need to manage, I think, how many you send, because I think it also creates a level of anxiety amongst the public and also a level of tiredness that you start, you know, avoiding it or not reading it because you get too many of them. So the reason why I talk about the paranoia that might happen or the anxiety it might create in people, because what happened in Seoul airport is we would walk around and a message went off again. And so you could tell who was South Korean because their phones would all go, doo, so everybody's phone would go off at the same time. Everybody would stop and everybody would look. And again, it felt like being in a movie, but I thought, you know, it's kind of a little bit confronting, I thought, to see that. But at the same time, it's useful. So those are things that Australia could consider. So what happens in Australia for me? So unfortunately, someone in my environment who had unfortunately been in contact with me, despite our self-isolation, got a fever and a cough. So we decided that to be on the safe side that we had to be tested. So we got tested on the 6th of March and we were lucky enough to get results unofficially on the 7th of March. But the official result only came on Wednesday morning. So if you are someone that's, you know, being stressed out about having the coronavirus and you have to wait 4 days, that's quite a long time. So I think the processes are getting faster every day because we are learning. So hopefully that waiting period for people will be reduced dramatically as Australia prepares. So the thing that I wanted to point out was this was the first time that only a phone call was needed to my GP clinic for safety. So after that, I could drive straight to the lab in my own car and I was taken aside and they did the testing. So I will come back a little bit later about how fast things are going with respect to testing, because I think this is already a method that is not the best method, but at that point, last Friday was an excellent method as well. So I wanted to show you a video. We're not only changing in Australia, but also in China. So I was lucky to get this from a Chinese colleague, and before I play you the video, I want to explain it a little bit. So the people are wearing a helmet, and it's got a lot of tech in it. So it's got ultra-red voice recognition and facial recognition, data tracking and mining, and an automatic alarm. So what it does, it can track people within a radius of 5 meters and I think 49 bodies. What it does, it then scans their temperature, and anybody with a temp over 37.3, then it triggers an alarm in their helmet. I have to laugh. And then an identity pops up. So it's also a system for teleconferencing and communication, and it can thus be used to avoid physical contact. So I thought it was really interesting how everything is combined to get this thing done. And if you think this is only can only be used in China, think again, because when I was just looking some stuff up around this, I just noticed that the day after I received this, that the Australian Police is claimed to be used in Clearview facial recognition systems, but I'm not sure if that's the truth. I just want to point out to you that those things are available and possibly happening. So I'll just show you the video so you can see how it works. And here you can see how they measure the temperature. So I talked to you a little bit previously about how I got tested last week. So South Korea pioneered the drive-through coronavirus testing stations. So now they're used globally in Europe, that I'm aware, US, UK, and Australia has started them as well. So obviously we have less contact with patients, it's safer for staff and patients, it's fast and efficient. So some further research showed that this is actually based on drive-through flu clinics in the past. However, South Korea has to be commended for, bringing this idea to life again, and so will be used in other places. So another innovation that will happen from this, it's not really innovation as per se, but it is in the sense that it is becoming more ingrained with our thinking. And I think that's the important thing to realize as well. So remote work will become more acceptable. So universities, for example, are asking workers to prepare for working from home. So for example, one of the messages is ensure that you have the correct technology to be working from home. That might sound very simple, but if you haven't organized that now and you have to work from home, that's going to be a problem. So we know that WHO has declared the pandemic, and Australia yesterday has announced the stimulus package to avoid a recession, which is also important for our casual workers. So the other thing is we don't know the answer to what's with the toilet paper in Australia. So people claim that it only happened in Australia, that people weren't buying toilet paper. I thought maybe it's just local, but I asked some people across Australia and it's everywhere. And then funnily enough, I didn't expect that. This morning I got a message from a Dutch person and she showed me a photo and I said, is this in the Netherlands that there's no toilet paper? And she said, no, this is actually in London. And she said, but it's also starting in the Netherlands. So I don't think toilet paper is necessarily only, an issue in Australia. So, like I said before, with innovation and change, I was sitting at home and I kind of really wanted to talk to other people about, what they were doing and how they were, coping and, were having fun whilst they were in isolation. So we've started today a Social Connection Facebook page. It's not an update page. It's not a page that will provide health information because we'll leave that to the experts. It's purely about people connecting with each other that want to talk about the coronavirus isolation. So it's also about fun, tips and connection. So it's, you know, I don't want this to be about just being negative or, you know, creating panic. It's more about, okay, how can we talk to each other and, you know, create a global community? So with the changes that are happening, we know that the hospitals are changing. So for example, one of the doctors in training I spoke to yesterday, this was his response. He said, yes, this corona business is everywhere. So they are creating a whole new board to act as a clinic in my hospital. And some people will care and some people won't care, of course, but I think it is great how our healthcare system is acting and making decisions and changing things. An item that I do want to bring up is I spoke with some people in a general surgery, and they said that rural hospital workforce can be extra vulnerable, and this might also extend to community care, for example, because if you work in a small area and you will have, let's say, a staff meeting and everybody gets sick, or one person gets has the virus and then everybody else has to be isolated, you have no workforce left. So I think that is something that needs to be considered, like how we do that. So staff meetings need to be maybe conducted remotely for the time being until we know what's happening. So just some further change in the workplace in 2020 due to the coronavirus. As you know, it changes really rapidly. I think one of the things that is interesting is the use of blended technology to combat the virus and the data analytics that you've seen. So the Australian Medical Association called for more funding for telehealth services to allow better access for rural areas and safety for staff. Now, you may be aware that this has now, since today, actually been provided. So people can be bulk billed and diagnosed, get a diagnosis over the phone. Well, not over the phone, but contact their GP if they need to get tested for coronavirus. So again, the crisis, I think, also has some good issues, because I think, for example, for community care providers, what we could do is you know, ride the wave of the changes that are currently happening and use it for the greater good. So I think it's a massive opportunity to improve telehealth funding and other things that can help us in rural areas, for example, to improve the quality of life of, you know, of our older people and people that need it. So the other changes that are happening, organizations globally are considering how to organize future meetings and events. For example, Anne said on Monday when we were organizing the workshop for last Monday that the coronavirus is a new risk factor as part of meetings and event planning. So that's another thing that hasn't happened before. There is clearly a renewed interest in hygiene at work. And as I said before, remote working will become more acceptable. And again, I think we should ride that wave to allow people to keep the ability to continue working remotely if that is possible. So at the moment, it often is still the case that as a worker, you need to ask permission to work from home. And so maybe we can make some easy changes into the future around this. So we need to have some communication, education between staff and clients, so that will change. There are issues, as you probably know by now, that staff have requested, are requested to take leave without pay. That has problems. So employers also need to watch the mental health impact of long-term self-isolation of staff and clients. We don't know what that will do on a population level. So health promotion is key. I've already talked to you about the casual workers and the entrepreneurs and the self-employed, that they are not protected for sick leave. So I would like to see some innovation in that space and some thinking around that. So if you've got any ideas, please contact Anne and the team. We see a change in values, as I said before, and the use of technology to reduce isolation. So again, you can see this as an opportunity. So for example, companies are providing free access to remote working tools. For example, the company TechSmith is giving people free access to work remotely. I don't have any relationships with TechSmith. That was just an example. So our question to you is, what can you add? What are the changes that we are seeing that can actually positively influence our society, our industry, and Australia? So please email us anytime, and I would be very grateful for people if they would like to share the Facebook group Coronavirus International. Thank you very much. That's what I wanted to get my message across to you today. Thank you for listening.
Thank you, Sabrina. Great presentation. I've got a number of questions that have come in from a range of people interested in this subject. The first question is from James. I have a staff team that are very worried and concerned. What would be your top 5 messages for me as their boss to assist them in lowering their anxiety?
Oh, thank you, Anne. I'm not a psychologist, so I cannot comment on that in detail, obviously from a mental health point of view. But obviously, everyone should practice good hygiene to protect against infections. So if you look at the government website that people should do, wash your hands often with soap and water for 30 seconds. Use a tissue and cover your mouth when you cough or sneeze, and avoid close contact with others, such as touching. But I would also want to say that the media, and this is my personal opinion, makes everybody a tad nervous. So I must say, I wasn't worried in Korea. It did feel like it was in a movie, but I wasn't really worried because I didn't understand the language. I don't think I got, the mass panic that some people may or may not have. Some people don't have, but some people do. So I suggest that turning off the media at regular intervals might also be useful, or, maybe go to a country where you don't speak the language. People need to remember that staying at home also has some benefits. So, if people are worried and, you might be in contact with someone that had corona, I can say that I actually quite enjoyed being at home with my daughter because, it was really lovely to spend time with her, and I could do things I usually don't do. And it was really quite peaceful at the same time, except for when I had to get really tested for the corona because someone had a fever. That was less funny. But, things are the way they are.
Thanks, Sabrina. I've got a question from Jordan. Thank you for a wonderful presentation, Sabrina. I look forward to being part of your survey and joining your Facebook group. Do you propose other activities in respect to this issue for community care providers? We really want to keep in touch and informed.
I think, so 2 things come to mind. Like I said, I just started the Facebook group Coronavirus Isolation International. So this is for fun, but also to connect people that want to know more about the self-isolation and, just meet other people across the world, really. And so no doubt, like with every crisis, we have some mental health impact of mass self-isolation and its consequences. But then the second thing that comes to mind is I like us to collect all the things we learned as an industry and build on that. So our forced innovation will help us into the future. So, and I hope your listeners can help with that and stay in contact with you and me about that. And so just to give you an example about learning and, changing things. So I had a meeting with a rural surgeon and emergency physician last night, and she explained about disaster management. So how they learned from Bali 1 and Bali 2 that doctors used to burn out and work 24 hours a day rather than doing 8-hour shifts, and letting the student, for example, carry the bloods. So they also learned, for example, and this is was new to me, that an X% of the hospital that of the patients that were there could have really gone home because they were waiting for simple things like a scan or blood results. So a hospital can be made more efficient in times of crisis. So they could identify how they could increase their capacity and efficiency. And I thought that was a really nice example. So my question to your audience is, like I wonder how that applies to your sector. But these are the things.
Yeah, thanks, Sabrina. Another question from George. We're a medium-sized community care provider in a regional area. We've struggled to get traction with mainstreaming telehealth and telecare technologies. I really think this global crisis will recognise the benefits of incorporating new technologies and perhaps remove some of the funding and policy barriers. Can you provide your comments on this, Sabrina?
Oh, that's a good question. Yeah, as I said before, on Monday, the AMA was still pushing the agenda, and I didn't know what was going to happen in the space of telehealth. But changes are happening rapidly. So that's what I'm saying. It changes every day. So the government, as you may know, has now announced 100 pop-up clinics and free telehealth services for people that need to be tested for coronavirus. You know, people, yeah, I think it's really good. So I believe since today that people can be diagnosed and bulk billed. And as I said before, I strongly believe that community care and other aged care service providers can push this agenda further to help their clients. So there's great opportunities to make real change for our older populations. And I think that is why, rather than being anxious, you know, as one of your previous questions was from one of your listeners, that they should also see this as an opportunity to make positive change. So I think there is a lot of positive to be gained from this experience.
Great. Just a final question from Sophia. Smart ways of doing work are really now what's required, aren't they? I understand you have been leading some work in this area. Can you expand on that?
Yeah, just one of the things that I'm working on, I chair one of the working groups within the International Organization for Standardization on an age-inclusive workforce. So it's about including older people in the workforce, and it's a very important item globally. So we've got about 15 countries that contribute to the development of this standard. So it talks about items such as smart workplaces, but also around dementia, seniorpreneurship, and a different way of thinking about how we in general include older people into the workplace and also the remote working areas. So I'm happy to speak more in detail about that. For those that are interested, they can contact me or Anne.
Thank you, Sabrina. I'm going to hand over to Georgie now to finalise today's presentation.
Thank you, Anne, and thank you, Sabrina. If you haven't already done so already, please go online and register for the collaborative. You'll be able to access today's presentation and have the opportunity to ask further questions. Please check the collaborative for more information on upcoming events. If you have any further questions or inquiries, please email us at sap@communityresourcing.com.au. I'd like to thank the members of the collaborative research team, today's guest speaker, Dr. Sabrina Pitt, and co-moderator Anne Livingston. Thank you everyone for your attendance today.
Thank you.